So this is work that I did with my colleague Bao Zhu, and we're both based in the Department of Epidemiology and Public Health at UCL. This was actually published a couple of weeks ago, and we were looking at gender divisions of unpaid care work and psychological distress during the first lockdown in the UK. So I guess the background to this is really that despite the fact that we have more women in paid employment than ever before, we continue to have gender inequality in terms of labor market outcomes in the UK and beyond. So as Manu showed us, we know that women continue to reduce their employment hours in response to parenthood more than men do, and 3/4 of part-time employees are women. We continue to have a gender pay gap in the UK and elsewhere. Women are overrepresented in low-paid jobs and precarious employment, and they're underrepresented in positions of decision-making and power. For example, about 1/3 of MPs are women in the UK, and fewer than 30% of FTSE 100 directors are women. So what's driving these persistent gender inequalities in the labor market? It's likely to be a variety of complex factors, but one factor that has been identified by various people, including the OECD in this report in 2014, are the persistent gender inequality in unpaid care work. They said that unpaid care work is the missing link in explaining gender gaps in labor market outcomes. And here, when we're talking about unpaid care work, we're referring to all of the services that are provided for free within the household to members of the household. So referring to care, but also housework. And more recently, the Women's Budget Group Commission for a Gender Equal Economy also recognized unpaid care work as being at the heart of persistent gender inequalities in the UK. So we were interested in looking at how these persistent gender inequalities in unpaid care work played out during the first lockdown in the UK. With schools closing and childcare facilities closing, there was likely to be an increased unpaid care workload with the need for homeschooling and childcare. More people working remotely from home means more housework. And also there might be an increased need for caring for vulnerable neighbors, friends, and family members who are shielding. So we were wondering to what extent this potential increase in unpaid care work was falling more to women than to men, similarly to Anna's work. And an early survey on this by the IFS amongst parents in early May showed that mothers were doing 2 hours more of childcare and 2 hours fewer of paid work on average per day than fathers. And because we're social epidemiologists, we were also interested to know whether this potential increased unpaid care workload might be influencing people's mental health. And again, there was an early report by the IFS which suggested that the decline in mental health that we saw at the start of the first lockdown appeared to be greater for women than for men. So our research questions were, how have couples in the UK divided unpaid care work between them during the lockdown? And then looking at associations with changes in levels of psychological distress for 3 aspects of unpaid care work. First, simply levels of unpaid care work, but also looking specifically at gender divisions in unpaid care work and how they might be associated with changes in psychological distress. And then looking at the potential impact of unpaid care work on employment schedules and whether that might be linked with changes in psychological distress during the first lockdown. We also looked at whether these associations differed for men and women, and also whether they might differ depending on whether people were living with a partner. Okay, so here we're using data from the first 2 COVID collections in UKHLS. You've just seen data from one of them already, but I think people here are probably familiar with these. We should highlight that the response rate to these 2 waves was around 40%. And here we're doing a complete case analysis. So we haven't taken account of missing data in this analysis. We have 6 samples that we're working with here, depending on the type of unpaid care work that we're looking at. And also when we're looking at gender divisions, we're specifically focusing on male-female couples. So when we look at housework, we're looking at all participants, but also then restricting the analysis to male-female couples when we look at gender divisions. When we're looking at childcare, we're focused on parents, and then couple parents for gender divisions. And then for looking at how unpaid care work, or specifically childcare and homeschooling, impacted on work patterns, we are focused on working parents and then couple working parents for divisions of labor. So you can see our different sample sizes there. Oops. In terms of our measures of unpaid care work, these have been covered in previous presentations. So people were asked the number of hours they spent doing childcare and homeschooling in the past week. They were asked the number of hours they spent doing housework in the past week. And then Understanding Society solicited items that people might want to add to the COVID sweeps. And we requested these next two items, which were added in May, which were specifically asking, have you reduced your working hours because of time spent doing childcare and homeschooling? Or have you adapted your work pattern because of time spent doing childcare or homeschooling? For psychological distress, we're using the 12-item version of the General Health Questionnaire, or the GHQ. We've used it as a continuous measure. And we're adjusting for the GHQ score at the prior wave of UKHLS wave 9. So we're doing that in order to look at change in psychological distress during those first few months of the first lockdown. We've adjusted for age, ethnicity, whether people are living with a partner, the age and number of children in the household, prior working hours, their own highest educational qualification, their own occupational class, and household income, all taken from wave 9. So these are cross-sectional multivariate linear regression models run separately in April and May. We check gender interactions between our unpaid care work variables and gender, and then separately for partnership status. So we've stratified our analysis by gender because we did find significant gender interactions, and also some differences by partnership status, which I'll come on to. Okay, so first, simply looking at gender differences in the amount of unpaid care work done by men and women in April and May. So the sort of darker gray bars are the data from April, and the bright blue bars are data from May, and the dotted bars are women, and the solid bars are men. So what you can see across the board is that women did do more unpaid care work than men. So for example, in April, mothers were doing about 20 hours per week childcare and homeschooling. This rose to nearly 23 hours per week in May, whereas fathers were doing 12 hours per week in April and May. Women were doing 15 hours per week on average of housework, compared with 10 hours per week for men in April and May. 17% of working mothers reduced their employment hours in response to childcare and homeschooling, compared with 12% of working fathers, and more parents adapted their work patterns. So 37% of working mothers adapted their work pattern due to childcare or homeschooling, compared with nearly 30% of working fathers. So when we go on to see how these are associated with psychological distress, again, the sort of dark gray bars are data from April, and the bright blue are data from May. The dotted bars are women, and the solid bars are men. So I think the first thing to notice here is that these are not strong effect sizes. So for example, there was a significant association. Increased hours spent in childcare and homeschooling for women was associated with increased psychological distress. In April, this coefficient was a 0.02. So to put that into context, we would generally expect to see a 1-point change in the GHQ across the income distribution from the top and bottom decile. So these are not large effects. For men, the coefficients were almost identical to those for women. They didn't reach statistical significance, probably because we have fewer fathers in our sample. We include lone mothers. In terms of housework, increased hours spent doing housework was significantly associated with increased psychological distress for women in April, but we didn't see this in May, so potentially some adaptation going on there of some sort. And we didn't see any association between housework and psychological distress for men. So looking at the association between adapting work schedules in response to childcare and psychological distress, we didn't see any associations for reducing employment hours, but we did when it came to adapting work patterns. So working mothers and fathers who adapted their work schedules to accommodate childcare and homeschooling had significantly increased psychological distress compared with working parents who didn't do that. But once we looked at differences by partnership status, we could see that the association for women was almost entirely concentrated amongst lone mothers. So these are the stratified results for women. And you can see this really striking, strong association, increased psychological distress for lone mothers who were adapting their employment schedules to accommodate childcare and homeschooling. Okay, we move on now to looking specifically within couples. So this is first just the share. This is similar to what Anna showed us just now, the share of childcare and homeschooling and housework that women did in the dotted bars and that men did in the solid bars. So women were doing about 63% of childcare and housework. This is in April, and the figures are nearly identical for May. And when we look at how working parents were adapting or reducing employment in response to childcare, you can see 2/3 of working parents, neither parent, reduced their employment hours to deal with childcare or homeschooling. About 1/5 of working couples, the mother was the only parent to reduce her employment hours because of childcare or homeschooling. In 11% of working couples, the father was the only parent to reduce employment hours, and in 4% of working couples, both parents reduced employment hours to deal with childcare and homeschooling. Adapting work patterns was more common. So in about 1/3 of working parents, neither parent adapted their work pattern. In another 1/3, the mother was the only parent to adapt her work hours to deal with childcare and homeschooling. In 18% of working parents, the father was the only parent to adapt his work pattern, and in 14% of working parents, they both adapted employment to deal with childcare and homeschooling. When we looked at these in association with psychological distress, we did not find any association for the share of childcare or housework that couples were doing. It was not associated with psychological distress. But when we looked at the impact on employment hours, we did find associations. So these are the regression coefficients for the GHQ for reduced employment hours on the left, and adapted employment patterns on the right for his psychological distress and hers. And the reference group here is couples where neither parent reduced or adapted their employment in response to childcare. The red bars are where both did. The bright blue bars are where only the mother did. And the sort of darker gray bars are where only the father did. So what you can see here is in working couples where the father was the only parent to reduce or adapt his employment to deal with childcare, he had significantly higher levels of psychological distress compared with couples where neither changed their employment. For mothers, we don't see an association in terms of reducing employment hours, but we do in terms of adapting employment schedules. So in working couples where mother was the only parent to adapt her employment schedule to deal with childcare, we do see higher levels of psychological distress for mothers. So our key findings were that women continued to do more unpaid care work than men and were more likely to reduce and adjust their paid work hours to accommodate childcare during the first lockdown. But also that trying to adapt work hours to accommodate childcare and homeschooling during the first lockdown was strongly associated with worsening mental health for lone mothers in particular. In couples, it looks like a sense of equity might be important. So in working parents where fathers reduced or adapted, they were the only parent to reduce or adapt their work hours for childcare, that they had fathers had worsening mental health, whereas in working parents where mothers were the only parent to adapt their work hours, she had worsening mental health. So in terms of implications, our results are in line with a report put out by Gingerbread at the end of last year, highlighting concerns about the impact of the pandemic on single parents in particular. And this is an area that I don't think we've heard enough about really in terms of the impact of the pandemic on people's lives. And our results are also in line with concerns raised by the Women's Budget Group and the TUC and others about the potential impact of the pandemic on progress in gender equality. So that's it. Thank you.